Hello everyone, I'm Amy Hall and I'm the project manager for the St. Jude Children's Research Hospital Instructional Module Project. Let me introduce our instructional design team. Jacque Bradford, the instructional designer, Raquell Barton, the instructional e-developer, Nicole Bond, the lead evaluator, and Michelle Bowen, the site manager. Our clients were Dr. Miguela Caniza and Dr. Miriam Gonzalez, who are both pediatric physicians in the Global Pediatric Medicine Department at St. Jude Children's Research Hospital. St. Jude provides care to pediatric patients suffering from cancer and other life-threatening diseases here in Memphis, as well as at over 27 international partner sites. These pediatric patients are more susceptible to infection due to their weakened immune systems from chemotherapy, radiation, and other therapies administered. Studies have shown that a majority of healthcare-associated infections are acquired via central venous access devices, typically accessed by nurses and physicians. Although infections can occur, nurses and physicians can aid in the reduction of hospital-acquired infections by using safe patient care practice techniques when providing care to immunocompromised patients. Currently, physicians and nurses acquire the knowledge to perform safe patient care practices during nursing or medical school, postgraduate training, or possibly during orientation sessions prior to working at St. Jude. But no formal standardized training exists for the nurses and physicians at St. Jude's international partner sites. And although the client could not produce infection rates for the international partner sites, they believe that the variability in education and safe patient care practices being administered are hindering the reduction of those rates. So the purpose of this project was to improve the knowledge and skills of the healthcare professionals in regards to infection prevention and control, with the ultimate goal of improving patient outcomes in pediatric cancer patients. So let's take a look at a visual that displays our need. So our desired status, the standardized infection and prevention control procedures implemented at all the international partner sites. But the actual status was there was a variability in these practices across all of those international sites, which created a need for the implementation of standardized infection prevention control practices across all of those sites. And so due to the lack of standardized infection prevention and control procedures at those international partner sites, the team decided to develop instructional modules that included pre and post tests, content, practice problems, and a skills checkoff list that focused on improving the nurses and physicians' performance of safe patient care practices. The two modules developed focused on hand hygiene and safe vascular access procedures. And while the modules provided knowledge-based intellectual skills, the skills checkoff list activity provided the opportunity for the nurses and physicians to practice these new skills and obtain proficiency in applying them in a real-world setting. The instructional modules were developed in Articulate Storyline 2 and will be housed within Moodle on St. Jude's Cure for Kids Learning Management website. So next, Raquell and Jacque will provide a demonstration and explanation of the modules.
My name is Raquell Barton, and I have served as the e-learning developer for Team St. Jude, and I'm going to be showing you a demonstration of both of the modules we created for St. Jude Children's and Research Hospital. When our client chose Articulate Storyline 2 as the delivery system for both products, we knew we'd have a short window of time to actually work in Articulate Storyline. So as a team, we decided to use PowerPoint as a storyboard for the project and begin building the modules there so that once I was able to actually work in Storyline, putting the modules together, the basic outline would be finished. The first thing we did was decide how we wanted the modules to look. We knew we wanted both of the modules to have the same look and feel, so Michelle created several options for us to choose from before we came up with the two basic designs we would use, one of which is the actual background of this slide. And this is the second slide. As you can see, they are similar in design and color scheme except for the placement of the maroon bar. We did decide to use this picture as the welcoming slide for both of the modules so that when the actual learners, the doctors and nurses of St. Jude Children's and Research Hospitals international partner sites access the modules, they will be assured that the modules were created by and for St. Jude. The next slides are a couple of examples that were created in PowerPoint before being uploaded into Articulate Storyline. This is an example of a content slide. This slide is an example of how each module begins before the pre-test and post-test. And this is an example of a practice slide. Now I'm going to take you through a few minutes of demonstration of each module. The first module I'm going to demonstrate is hand hygiene. Since both modules are about 45 minutes in length, the demonstration will be cut short. Thank you.
I would like to introduce you to the navigation features contained in this module so that you can access everything with ease. The sidebar menu to the left of the screen includes a list of all the slides in the module in an outline fashion. Although you can click ahead, the topic we will address in this module is hand hygiene. Take a moment to reflect on your hand hygiene practices. Are you using best practices in regards to your hand hygiene? Are you taking the necessary steps every time to prevent the spread of infection? In order to get an idea of what this module will cover today, please take a moment to review the 6 objectives. Prior to beginning the module, please take a moment to answer some questions to assess your current knowledge. It is okay if you don't know the answers. You will learn them during the module. You will proceed to the module once you have completed the pre-assessment questions. Did you know that thousands of people die every day around the world from infections acquired while receiving health care? Hands are the main pathways of germ transmission during health care. Therefore, when it comes to hand hygiene, there are some basic terms used that are very similar, yet mean something slightly different. Please click on each term to reveal each definition. Click anywhere inside the pop-up box to close the definition. Move on to the next slide for practice once you have reviewed all of the terms.
I am now going to take you through a few minutes of the Safe Vascular Access module.
To introduce you to the navigation features contained in this module so that you can access everything with ease. Care hospital setting. Patients at risk for central line associated bloodstream infections or CLABSI include the use of specific types of catheters that are almost exclusively inserted in ICU patients and associated with substantial risk, such as pulmonary artery catheters with catheter. Please be aware that although we are discussing central venous catheters here, peripheral artery catheters also carry a risk of infection for the same reasons. Other risk factors for CLABSI susceptibility are prolonged hospitalization before catheterization, clearly outweighs the potential for undesirable effects. The phases that we will discuss are listed here: before insertion, at insertion, and after insertion. Please.
Thank you, Raquel. I am Jacque Bradford, the team instructional designer. I would like to briefly discuss with you why we created the product as we did. To begin, our client requested instructional modules for nurses and physicians to review on an annual basis to keep infectious disease prevention and control practices and knowledge current. We are working under the assumption that these nurses and physicians have already acquired this knowledge through entry-level coursework or through the St. Jude Children's Research Hospital new hire orientation. Our clients selected 30-minute modules over a web-based distance learning format that included units of reading and the completion of assignments. In regard to the duration that each module takes to complete, 30 minutes was recommended because this was a good time frame to allot for these nurses and physicians to complete during their work schedule. This time frame was confirmed with the participant responses and performance on our one-to-one trials. Next, the modules were developed using Articulate Storyline 2 to utilize the many interactive features that Articulate Storyline 2 has available. The interactive nature of the modules was of great importance to our client to not only motivate and engage the learners in reviewing this material, but also to fulfill the need for learner motivation and engagement presented in the content analysis. The module design scheme, as presented by Raquell, was created to complement the instructional strategy of Keller's ARCS model. ARC stands for Attention, Relevance, Confidence, and Satisfaction. We achieve these elements by capturing the learner's attention using introductory videos presenting alarming statistics and consequences of poor infection prevention and control practices. Relevance was captured by designing cases that are situated in a healthcare setting and involving infection prevention best practices. Confidence is gained through practice exercises occurring immediately after reviewed content material, with provided feedback on the accuracy of the learner's responses, in addition to, hopefully, the increased score on the post-assessment in comparison to the pre-assessment score. Satisfaction is achieved with successful completion of the post-assessment and skills check performances. The modules will be embedded in the Cure for Kids Moodle learning management system to store assessment scores for the modules. Now on to Michelle to elaborate on the interesting and unique features within our modules.
Thank you, Jackie. I'm Michelle Bowen, the lead team site manager. When we began planning, our goal was to include interactive practices and interesting videos in order to keep the learners engaged. In the hand hygiene module, there's a short video from the University Hospital Birmingham that shows how easily pathogens are spread from one individual to another when proper hand hygiene practices are not observed. Each infected individual and object are highlighted in yellow to show the chain of infection. For the Safe Vascular Access module, we chose to create our own instructional video with the help of a resident at St. Jude. This video illustrates the proper procedures that are to be followed for safe vascular access. Each of our practices include a drag and drop or matching question, as well as asking the learner to correctly order the steps. We chose these methods of skill review in lieu of the traditional multiple choice questions in order to sustain an active learning environment. In several of the questions, we used diagrams from the World Health Organization. The purpose of this is to ensure the continuity of learning materials throughout the modules, as well as employing the same literature that the target audience will see throughout the hospital in which they work. Now, I'll send it to Nicole, who will discuss the evaluation methods.
As the lead evaluator for Team St. Jude, I was tasked with developing a formative evaluation plan. The purpose of the formative evaluation plan was to determine the overall effectiveness of the hand hygiene and the safe vascular access modules. We use the key indicator of improved knowledge and performance of healthcare professionals to determine the effectiveness of our modules. Here you see the methodology used for the formative evaluation plan. We have a subject matter expert review with one physician and one nurse. In our one-to-one evaluations, we have 3 visiting MDs from St. Jude Children's Research Hospital's international sites. And for the small group evaluations, we have 3 physicians who evaluated the instructional modules at their international sites. We had 9 objectives to evaluate the modules. One of the objectives was to evaluate the content of the modules to see if it was current. Here we have an example of some of the content from the hand hygiene module and the safe vascular access module. After the formative evaluations, feedback was gathered, analyzed, and changes to the instructional modules were made. Based on some of the feedback received from the subject matter experts, this pre-test slide was changed to include new terminology given by Dr. Gonzalez. Based on feedback from the subject matter experts, this slide was revised to include pictures instead of words. Based on feedback received from the one-to-one evaluations, videos such as this introductory video in the Safe Vascular Access module was updated to automatically advance to the next slide when done playing. Based on feedback received from the small group evaluations, this pre- and post-test slide in the Safe Vascular Access module was changed to this matching format. This was due to the fact that in the original module, the format included drop-down menus in which the answers were duplicated. This was a quick overview of the formative evaluation plan and results. Next, we will have Amy with lessons learned. Thank you.
I'm going to wrap up this presentation with the top 5 lessons that we as a group learned from this project. Number 5, teamwork is essential to get the job done. Number 4, make sure you have immediate access to the software being used, so you are not constrained by time limits of free trials. Number 3, Murphy's Law. Expect and make contingency plans for the unplanned occurrences and mishaps. They're going to happen. Number 2, flexibility. You are not the only stakeholder. Everyone thinks differently, has different motives and visions of the end product. Prepare to change at any time. Failure to do so could result in delays to the project. And finally, our top lesson learned. Transparent communication is key. Make sure all stakeholders are on the same page. Don't assume anything. Ask. This includes every aspect of the project, from the client's vision and expectations to team dynamics. The clearer the communication, the better. This concludes the St. Jude Instructional Design project presentation. Thank you for your attention.